I'm Dr. Clare Rayment. I'm a consultant in palliative medicine in Bradford, and I'm also lead for the hospice placements at the medical school. Today I want to talk to you about how to help students with the emotional impact of being on clinical placement. So I think increasingly there's evidence to support the impact of caring on all the healthcare professions. Burnout, stress, emotional resilience are all terms that we're hearing more of as our clinical workload changes. And our job as teachers is really important in being able to help and educate our students about how best to manage that. I think some of the difficulties that often they see really distressing and difficult circumstances, often on a hectic and unfamiliar environment. So students would see resus calls in A&E, or they'll see discussions about stopping ventilation in ICU, or patients being told really distressing news, up to care of the actual imminently dying. And all of that can have quite an impact on our students, and how we respond to them can be really important. So I think the first thing I've learnt that's really important is to just acknowledge the difficult situation. So often phrases such as, that must have been tough hearing that, or how are you after that was quite a difficult conversation, can be really powerful in just opening up that discussion really about those difficult circumstances. And that often leads on to discussions about how you as a clinician manage those difficulties. So acknowledging that it's okay to be upset is a really valuable first step, I think, and recognising that as doctors we're not automatons, we are human, we're allowed to react and respond to that. And actually that's a positive thing, that demonstrates your caring and compassionate nature, so which are all very, very good things as a doctor. So not to think of it as something shameful or worrisome. And another very powerful thing is if you feel able as a clinician and a teacher to talk about how you do and have managed your own emotional responses. That's a really powerful role model really for our students in learning how they need to be thinking about it now and in the future. People often worry that opening up these conversations might take quite a lot of time out, but actually my experience is that actually it's a short conversation, but what that does is enable that student to go away and think about it and how to maintain themselves going forward in their career. So I think it's really important to talk about ways of managing when you are upset. Some of it's the importance of talking to colleagues and friends about the impact of work. Sometimes it's about talking about maintaining a good work-life balance, which is ever more challenging. Another thing, if you feel able, which can be really powerful, is talking about how you actually manage it in your role or have done previously. So sharing that information and role modelling that can be a very powerful teaching method for our students. One really important point is to say it's okay to feel upset or to have, an emotional response to a patient. And in fact, it's really valuable. We're not robots, we're human too. So it's important to reassure students that it's okay. And in fact, it's quite a positive sign. If you're upset, that means you care, and, caring and compassion are at the core of what we do. So it's a positive rather than a negative thing. And I think the importance is in recognising that and not trying to think it's something shameful or worrying that they need to hide behind. Often it can be really powerful if you yourself feel able to talk to the students about how you manage difficult or emotional situations and what you've found being helpful over your career. And that role modelling is a really powerful educational tool really, and students seem to value that quite a lot. So in summary, supporting students with their emotional health over a placement is really important, and being able to open up a conversation is the first step in a healthy dialogue over their career really, in maintaining their own emotional health and well-being. You role modelling that is a really powerful demonstration of how that can help going forward.